Good morning, everybody. My name is Ian Fanner and I'm Managing Director at Claremont. Welcome to our latest behaviour change briefing event. Today, we're focused on how AI can be used to change behaviour for social good. We'll be exploring the intersection of artificial intelligence and social impact and how AI can be leveraged to create positive change in society. Expert panelists will share their insights and experiences on the topic, and we hope to have a thought-provoking and engaging discussion. So sit back, grab a coffee, and let's dive into the world of AI for social good. I should say at this point that every word I've just said was suggested to me by ChatGPT. And other than the fact that I don't usually say the word leverage, it's not very plain English, it's not a bad intro, and it saved me at least 20 seconds having to think of my own. I promise, though, from this point on, I will be my own authentic self. So with that in mind, can I start by sharing why we chose to talk about this topic today? A few months ago, I think everyone will have noticed that everything went a bit AI mad. Everyone was talking about it. ChatGPT was launched. Pretty much every other tweet and LinkedIn post was sharing tips on how to use it. And it was obvious that the world was about to change, and it wasn't quite clear how, but it felt big. And we wanted to get to grips at Claremont with what that meant for us and the work that we do. And so we started doing our own learning on it. We started looking into how we might be able to apply AI, use it in productive ways, but also try and understand what the limitations and risks associated with it would be. And what we found really fascinated us, and we thought it would interest you too. And so we pulled together a panel of interesting speakers who all bring slightly different perspectives on this issue. And we've been able to get a good group of people together for today's event. I have to say, since we made that decision and we started organising this, the pace of change has only accelerated, and it feels a bit like the Wild West out there in relation to AI at the moment. The big tech giants are in an arms race for supremacy. GPT-4 was recently launched, and that is a huge leap on from the previous iteration, and there are new tools emerging almost every week, which are both incredibly impressive and, let's be honest, in some cases a little bit scary. And even Elon Musk now is saying that everything's going a bit too fast, and that sounds like a warning that maybe we should be listening to. However, that all said, we're not really going to get into in too much detail today the ethics and the implications of AI for the future of humanity. We might touch on it, but the focus is really going to be about how AI can be used for behavioral science, for behavior change, and for social good in particular. And we can see ways in which AI it can do that. We're going to share some very practical examples today. We want to help you take away some tangible stuff that you can start to apply to your work. I should stress that while we will be talking about generative AI like ChatGPT, DALL-E, and other tools like that, our focus isn't just on generative AI. And in fact, two of our speakers today will be focusing on the use of AI that has nothing to do with generative AI. Now, if you're like me, you might be worried that today's talks will get into complex technical territory. We have briefed our speakers to try and make this as accessible as possible to a non-expert audience, and I certainly will be wearing the non-expert hat, trying to guide today's discussion, as will the host of our Q&A session towards the end, which is Jude. Jude, can you pop your camera on and say hello?
Good morning.
So before I introduce our speakers, can I please ask attendees to introduce yourselves to us if you haven't already done so. So please do use the chat function and let us know your full name and where you work and what you're hoping to get out of today. And also please be aware we are recording today's session, and a recording will be made available afterwards on our website, and a link will be sent to all attendees. Okay, without further ado, let's introduce our speakers. So first speaker, if actually all our speakers could come on camera now, that'd be great. Thank you. So our first speaker will be Dr. Stuart Mills. Say hi, Stuart.
Good morning, everyone.
So Stuart is a behavioural economist and author of the book AI for Behavioural Science, which I've been flicking through this morning. Stuart will discuss with me how AI intersects with behavioural science and explain the concept of AI as an autonomous choice architect. So we'll get into what that means shortly. Next up will be Samuel Salzer.
Hello, hello.
Samuel's been at one of our events before as a speaker. He's a Claremont advisor on behavioural design, and he's joining us by the magic of Zoom from Sweden. I'm quite sure what's that backdrop, Samuel?
It is snow, actually. So we have about half a meter of snow here. So
goodness me,
spring is coming. Yeah.
So Samuel's talk will focus on the emergence of the generative AI tools. Samuel's got the unenviable task of attempting to give us a presentation that is up to date as possible, given the pace of change. And so Samuel's going to look at how those tools can be used and applied to behaviour change. We'll then hear from Dr. Sheuli Porkess. Am I pronouncing your name right, Sheuli?
Yes. Morning,
Marvelous.
everyone.
Sheuli is CMO for Life Sciences at a company called C2 AI, which is a UK-based firm that operates internationally, which has developed clinical AI-backed systems that help hospitals and health systems reduce avoidable harm, mortality, and cost. And then finally, we'll hear from Dr. Katie Russell, the third of our doctors in the room today. Say hi, Katie.
Morning, all.
Katie is data director at OVO Energy, which is using AI-backed smart meters to provide customers with personalized advice on recording energy use and carbon impact. So I think you'll agree we've got some pretty impressive credentials in our virtual room today. Please do ask our speakers questions as we go through. We've got, as well as the chat function, we'd prefer people try and post questions as possible using the Q&A function, which you should see at the bottom of your screen. We will have a panel discussion at the end of the presentations, which will be ably facilitated by Jude. We'll do our best to address as many of your questions as possible in that discussion. But also some of our speakers might choose to answer your questions directly in the Q&A function as we go. So, okay, at this point, can I ask our panelists to go camera off except Stuart, and we'll get going with our discussion about the work that Stuart's been up to. I mean, Stuart, we were just joking before the event got going about the timing of your book, and I can't help but wonder, did you know something the rest of us didn't when you were choosing to publish a book about AI and behavioural science when it published the week that ChatGPT launched?
I suppose the witty answer is to say I used an AI to predict the best timing, but no, it was just a moment of serendipity. But the pace of change does mean that I put stuff out and immediately it is outdated. It's also not necessarily good as someone that has to write a lot, so that my writing is increasingly being accused of being written by AI. I don't know if that's a compliment or not.
Well, let's start by talking about what is artificial intelligence. I know in your book you talk about that being there being far too many definitions of artificial intelligence, but for the purposes of today, just to kind of set the scene a bit about what we're talking about, can you have a go at succinctly defining what we're talking about?
Yeah, I'll have a go. I mean, my perspective is mostly, let's define what is actually happening today rather than what has happened in the long stream of AI history, because it is not a new topic, to be frank. There have been far too many definitions. The European Commission a couple of years ago counted up to 55 official definitions, and when something's overdefined, it kind of is not defined at all. For me, what we're dealing with right now, what we call AI right now, is really, we could call it probabilistic prediction models or some sort of selector model. Essentially, all AI today is tasked with acting as a sieve for a large amount of data to try and predict optimal outcomes or to select optimal outcomes. And what counts as optimal depends on the institution or the organization that has designed the AI and has the rules that they have to follow, but also it is affected by whatever data is put into the sieve. The key takeaway is this idea that AI today is really just about trying to take a huge amount of data and get to an answer that we can do something with. Of course, we shouldn't necessarily ignore AI today has a cultural dimension. It has existed in our society for a long time through things like science fiction. I think when some of the somewhat hyperbolic discussions about AI taking over the world come into play. I know we don't want to touch on it today, but I think a lot of that is driven by this cultural aspect. Again, I won't get into it, but there's obviously a technical side of things that could define AI as well.
Okay, I'm interested in a definition, or not a definition, but kind of almost I guess an opportunity that you describe in your book for AI to act as what you describe as an autonomous choice architect. Can you explain that concept a bit?
Yes, so the concept comes about or came about when myself and my colleague Henrik Satra, we started with quite a simple premise that AI should be able to do functions that humans can do. And so as a behavioral scientist, as a behavioral economist, with a focus on policy, I was looking at, well, what do behavioral scientists do? Behavioral scientists are choice architects. They design the choices in which people navigate. Really, and to a degree, kind of in a reductionistic sense, we boiled it down to there's a set of outcomes that a person could choose, and there's a set of design choices that could be attached to each of those outcomes. And really all a choice architect does is they try and pick which design aspect and which choice to, for lack of a better word, nudge a person towards. And we looked at this function, very mechanistic understanding of a choice architect and a behavioral scientist. And we said, well, in principle, if an algorithm or an AI, an artificial intelligence, had enough data, there's nothing that really stops an AI from making these choices in the same way that a choice architect does. And does this mean that you could have a kind of automated behavioral science where a term I like, moving away from choice architecture, a term I like is choice environments, where entire environments are dynamically designed based on AI predictions about human behavior. And so we had this idea and it seemed a little bit scary, but as we observed the literature and just observed everyday life, it seemed like a description that started to be more worthwhile.
And it's already happening, right? I mean, can you perhaps sort of contextualize this? Give us a few examples of how this is already here today. This isn't about what's going to happen in the future, is it?
Yeah, I didn't know how much you wanted me to jump into it. So there's a plethora of examples that we talk about, and I talk about in my book. The most common example, the example everyone is familiar with, even if you don't realize it, is recommendation systems on social media. So a social media feed is a choice environment. There's a limited amount of space on the screen, and someone or something has to decide what post, what video, what image is shown to you. It's not an environment that is easy for humans to navigate because, say, Facebook or Instagram or Twitter, they're enormous sites. There's too much information for a human to intelligently navigate. So you need some sort of algorithm. And what the AI on social media does is essentially act as an autonomous choice architect. It tries to predict what content does a person want to see. Now, when I tell my students about this, some of them see it as a very positive thing, some of them see it as a very negative thing. That we can perhaps throw that to the Q&A. But what I want to emphasize with something like a social media algorithm, social media AI, is there's not really any human involvement. And I bring that up because if we move over to, say, the policy space and look at, well, where are autonomous choice architects being used in, say, government, it serves the same function. So there's some brilliant work by Professor Susan Michi of UCL, using AI to try and filter academic material about behavioral science in healthcare to come up with intelligent healthcare policy much more rapidly than hiring a team of academics such as myself to read all the material and summarize it. That's potentially really powerful for driving policy forward, but they emphasize you still have to keep people in the loop, whereas when we're talking about, say, social media, there isn't a human there. I think that's a very important aspect, at least in my work.
You gave the example in the book, didn't you, when you were talking about Susan Michi's work about a sort of smoking cessation program you might be trying to create, and how there's just almost too much literature for humans to be able to reliably go through and understand, and there's too many variables across each of those different studies that are done, what have you, whereas the computational power of AI can blast through that at speed cheaply. But there's limitations to that, aren't there, and risks attached with relying too much on AI.
Oh, absolutely. I mean, an awful lot of the discussion in the field right now naturally is how can we use AI to understand human behavior better? But for me, the more important question is actually how are humans going to use AI? Because it's very nascent literature, but I think it's very important literature. We have evidence from, say, using AI in policing or in judicial decision-making, where the headline result is AI will help, it will lead to more equitable outcomes, better use of resources. But when you dig down into it, you see classic human biases like confirmation bias coming in. And it doesn't really matter if you have a super powerful tool. If the tool is being used in a suboptimal way, you're not going to get equitable outcomes. The other sort of behavior that seems to be coming to the fore is what we could call automation bias. This is a social psychological idea, which is people automatically defer to AI outputs. They doubt themselves, they doubt their own agency, and they say, oh, well, a computer said this is what the outcome should be, so let's go with it. And again, you can
imagine at the start of the pandemic that maybe if that happened 5 years hence, is there a risk that you kind of have decision makers in policy saying, what does the AI say we should do?
Yes,
right.
Absolutely. And it's a really dynamic, really fluid space right now. There's all sorts of discussions about, are AIs biased? Can AIs actually de-bias us? How do we tackle this interesting intersection, which broadly in the literature, the term I like is artificing. How do humans and AI work together? It's a very dynamic, fluid space right now. And that to me is a big concern. If we're going to embrace this technology, we need to think critically about how are we using the technology.
Which kind of bleeds into the next question I was going to ask, which is, how important do you think it is that people who are currently in behavioral science and working in behavior change today, which I imagine quite a few of the people who attend our events are in that space, how important is it people start to get to grips with AI now?
I think it's important for two reasons, one more general and one more specific. Generally, I think AI tools, even though I have some personal criticisms of them, I can see the productive potential there. So I think work in general is probably going to embrace some elements of AI. So generally, it's going to be worthwhile. Specifically, I don't want to take too much credit for this, but within behavioral science, there is a growing turn towards more consideration of subjective factors or the context in which interventions happen. Some of my early work was on personalization, and that kind of feeds into it. And increasingly, and I know this from teaching behavioral science students, this interest in data science and behavioral data science. And I think if increasingly behavioral science is going to be involved with big data analysis or thinking about how can we personalize interventions, you're inevitably going to be getting into, say, the machine learning territory, which underpins the current generation of AI.
Okay. I mean, we said at the start we weren't going to focus heavily on the ethics of AI and its implications for the future of humanity. I think that's a whole event in itself, and I think if people are into that, I'd recommend listening to the Moral Maze on Radio 4. They got into that in some detail yesterday, and a really interesting discussion. We're not going to do that at depth today, but it feels wrong to also ignore it. So sort of finally, Stuart, what's your take on how worried we should be?
I'm not necessarily worried about technology per se, because I think it's a lot more limited than is popularly discussed. My biggest worry is about people failing to understand what the technology is. I think for a lot of people that haven't interacted with AI before, and I had interacted with AI before, it looks magical, it looks extraordinarily powerful, and in some instances it is. I remember teaching classes only a couple of years ago where I would use AI generated art, and it was terrible back then, and now it's extremely good. But that doesn't mean it's actually magic. It doesn't mean that we have necessarily broken through some sort of frontier. It is technology, and it's technology which humans have designed, and that's really what I'd encourage, not to see it as a solution to everything. And if we do, I think that's potentially a big problem.
Okay, thank you. Thank you, Stuart. That's an excellent introduction to the topic for today. If you can go off camera now, we'll bring Samuel in. Before Samuel gets going, a quick reminder, we will field questions at the end once we've heard all the presentations. So please do pop any questions you've got into the Q&A function. Okay, over to you, Samuel. If you can share your screen and give us your presentation.
Yes, thank you, Ian. Great to be with you all. Big topic, AI tools for good. I have about 10 minutes, so let's get into it. My background is using applied behavioral science to build products and services. So what I generally do is helping product teams to make use of behavioral science for good. Increasingly, I've been doing more and more work combining that with AI. It started about a couple of years ago, and it's become more and more of a both part of my work in terms of the products I help to build, but also how I work. And so that's kind of where I'm coming from today, is to kind of provide my perspective of, day-to-day using AI for building interventions, but also just improving my day-to-day work. So one thing that I recently came across that I think is a wonderful book, it's Through the Looking Glass by Lewis Carroll. In the book, Alice comes to this world where the Red Queen explains that this world moves quickly. To stand still, you have to run. And if you want to get ahead, you have to run twice as fast. I don't know if any of you can relate to this feeling. I certainly can in this environment. As mentioned, Elon can probably relate to it as well. My goal today is to give you a little bit of breathing space, to maybe provide you with a chance to demystify the current state of AI tools and make sense of them, and maybe how you fit in kind of using them. So let's start with meeting the machine. We got a really nice intro on some of the background on AI from Stuart. One, I think, common example that's used is ChatGPT. So what is ChatGPT? Well, it is an AI tool built by OpenAI using their GPT-4 model currently, which is a large language model. And so there's nothing special with ChatGPT in terms of it's just an interface for that model. As you probably will notice, most AI tools are actually built on a very few number of models. And so the interface changes, but oftentimes the model stays the same. And prompt has a really important impact or use because that's in some ways your language in communicating with the model. And so prompt engineering is used to kind of making the most of that opportunity. But again, the interface doesn't have to be ChatGPT. It could be Google Docs. In fact, for quite some time now, I've used Google Docs with the API from OpenAI, and it's been great. It's been really, I've done more than knock jokes. It's been really fantastic. And that is what we're starting to see more and more. These APIs starting to sip into most tools. And so that's going to continue. And it's been interesting for me to kind of deal with that for the last some time. And I think it offers quite a big change in how we work. But one thing to remember is that while it might feel like the emergence of AI has some form of human level intelligence, it's not human-like. And that's an important distinction. So one of the many bad metaphors for AI is a horse, but I'll use it here as one metaphor at least. And it's useful because it distinguishes us from AI and that we might have a journey we want to get to, and having access to this horse can get us there quicker, but we still have to ride the horse, and we're not unimportant. We are there to lead the way and steer, and obviously have to kind of be that guide. And so let's talk about us. Let's meet the mind as well, not only the machine. What I would say perhaps is the most important thing I want to kind of get across today is less about the tools, but about your expertise. Your expertise is really a crucial determinant in utilizing AI's potential. So what I mean by that is if we create this graph where we have kind of domain expertise on the left side here, and we have AI expertise here, we can broadly split up into this 4 quadrants where you have some novices, some AI enthusiasts, you have some people with high domain expertise, and then what I currently call as experts squared. You have someone that's both an expert in AI or somewhat of expert and have some domain expertise as well. That becomes really relevant when you look at output quality and quantity. So surely, of course, domain experts has much higher quality than novices. But when adding this AI to the equation, it actually creates a stark difference. You have certainly in this case, the expert square being kind of a clear winners. And a good example is Andre from AI, who's a senior director and programmer there. And he now uses GitHub Copilot to write 80% of his code. So that is the potential to write 5 times as much code with the same quality as before. That is extraordinary in many ways. But what about the AI enthusiasts? How far can they go in terms of delivering quality as well? Well, obviously, when you have low expertise and added AI, you pretty much become efficiently bad for the most part. You don't know what good looks like. You write poor prompts, wrong questions. You're easily fooled by kind of hallucinations by the model, and you generally create generic material that is barely above average. But there's still hope. And if you have very low expertise or medium expertise, you know, the higher up you go, the more you can leverage. And so what's recently been tested, very recent paper, is showing that, you know, use ChatGPT could improve quality in writing by 20% and in half the time. And that is a pretty significant change. So what about people here? What about domain experts? Well, in some ways, these are the people I'm trying to speak to today and help. So if you have a job, you have expertise. And so hopefully you shouldn't maybe be too worried about AI taking your job, but it's very likely that you might lose it to someone using AI. And so let's see how we can use AI and see some use cases for, I'm a behavioral scientist, but also maybe for other people. There are some low-hanging fruits here. And when it comes to using AI tools, I would say some of them are the likes of literature reviews, content generation, and any type of productivity tools. I'm going to focus on literature reviews because I think it's a personal, interesting case study where previously I wasn't that great. maybe the end product was pretty good, but it took a lot of suffering, a lot of mess, and not the best efficiency. And what blew my mind is about a year or so ago, or maybe more, when I started to use more of the AI tools across this process. And so, as an example, I started using Elicit, a tool to help me discover what is the right research question I should ask, and what are the top maybe 5 research papers on this question. Having those papers, I could then use Research Rabbit, which feeding those questions in can start building a graph for me, where eventually I could have a collection of 100 papers that are all relevant to this specific domain. I love automations, and so using Zapier and other automations, I can then quite easily connect Research Rabbit to the likes of Zotero or Google Sheets or Airtable, and suddenly I have this really rich database of literature at my disposal. And if I struggle, I can always ask something like Cite AI or Explain Paper, or even using, again, the GPT AI API directly. And it can help make sense of things that I don't understand. And so it's really drastically changed my work process. And especially when I can also then have the GPT-4, for example, API summarize some of the findings and help me feed that into the Google Docs or whatever thing that I'm going to deliver at the end. And so it still relies me being a lot of the person who judges and reads and make decisions of what is good research, but it leads to a higher quality output much quicker and less headache. So this is just an example of how I'll use it, and hopefully show that, you know, just one of these tools could be useful. You don't have to use all of them, but just starting to use one of these can be quite effective. And so on that point, I will now expose you to some AI tools. And I don't want to overwhelm, I try to keep it simple here. And the goal is not to show you a lot of tools, but just give you a starting point. So I'll share this image definitely on LinkedIn, but hopefully I can find a way to share in the chat here as well. But pretty much here, I try to sort it so that you have one tool to start with, depending on what problem you're trying to solve. And again, there are many tools, but most of the tools I'm showing now are quite well established. They're very unlikely to be replaced today, tomorrow. We'll see in 6 months. But even so, I would say the opportunity costs are much higher than the switching costs. So getting used to using some of these tools, communicating them, utilizing them, there's a lot of value in that. And switching from one to the next is actually quite easy once you get into it. So while I can talk about these AI tools for a long time, and individually I can talk about all of them, but I also don't want to kind of lose the kind of recommendation here that you shouldn't lose your process, because I think it doesn't really matter if you just throw 500 AI tools, you know, to your process. If you don't have a good process, it doesn't really matter. And again, you should only use the AI tools that serves a point, have a reason for using them. And so I don't really have time, or my role is not to talk about behavioral interventions, but that is obviously something that's very close to my heart. And it's not as much of a low-hanging fruit, but it's certainly a very important fruit to explore. It can be really, really impactful for personalized interventions, for kind of perspective taking, or for user research. And if you're interested, happy to share more and talk about it. So just reach out. But to leave you with some recommendations in terms of using AI tools, I would say, remember that your output is generally only as good as your prompt, especially with any type of generative model. So prompts provide context, and as behavioral scientists, we know that context is king. Second, don't use ChatGPT for everything. I love ChatGPT, it's great, but remember that it was pretty much designed to be an autocomplete to give you convincing answers, not to tell the truth. So it will give you fabricated references if it thinks that will make you happy. Lastly, remember that it's really great to make AI do things for you, but I wouldn't recommend it to use it for thinking for you. You should be really, really deliberate when you're using it, and being clear about what is the objective you're trying to have as an output, kind of formatting for that answer, and also what are some lists of things to avoid. Providing that to the model can really make a huge, huge difference. So yeah, that was this speed round of exploring AI tools. happy to discuss more of this, but I really want to recommend you all to leverage the expertise you have. It really, really matters. And now is the time to really kind of hopefully explore it further. So maybe the best AI tool I would recommend, if anything, is ChatGPT. I had a lot of fun with that yesterday. It's really good for getting really thoughtful questions on everything from behavioral design to you name it. So try ChatGPT as well if you want. But yeah, that's it for me. Please connect on LinkedIn. I'm going to share more on LinkedIn on this topic, and we'd love to hear from you. So I hope this was helpful, and thanks for the time. Thank you.
Thank you. That's really, really interesting, Samuel. I've never heard of ChatGPT before. That's a new one on me. I'm going to definitely look that up afterwards. And yeah, you've definitely met your brief of giving us lots of useful tools as starting points. I suspect some people might be feeling overwhelmed still by the choice they have in front of them. And as you say, it's changing every day, every week. I think it's good advice to sort of pick one and start to have a play and get comfortable rather than being overwhelmed by the sheer mass of options you've got in front of you. Okay, thank you, Samuel. We'll come back to you for the panel discussion. I've no doubt there'll be some interesting questions for you. And again, a reminder for people to pop questions in the Q&A function if you've got them. Okay, we're now going to hear from Dr. Sheuli Porkess from C2AI. So Sheuli, camera on, mic on, marvelous, thank you. And yeah, if you can share your screen and give us your presentation on the way in which C2AI is using AI. And then we're going to move away from the world of generative AI for the next two presentations, aren't we, Sheuli?
Yeah, can you see my slides okay?
We can.
Perfect, great. Well, thank you very much. And yeah, great to be part of this panel today. I'm Sheuli Porkess. I'm a pharmaceutical physician. So I qualified as a doctor, worked in the NHS for a while, and then specialised in pharmaceutical medicine, which is the medical specialty that deals with developing, licensing and monitoring new medicine. I've worked for and with a number of different pharmaceutical companies over the years and trade associations, and I'm now delighted to be working in the field of helping improvements in healthcare through analysis of information on patients' health, also known as health data or real-world evidence. And we do this using AI. So I'm Chief Medical Officer for Life Sciences at C2AI. Sorry, just moving my slide. So just what I'm going to talk about today is a little bit about C2AI and what we do, which is called clinical risk prediction, and I'll explain that. And then how it actually helps behavioural change to improve health. And I'll give four short examples of what we do with the health service, working with health professionals, working with helping patients, and also thinking about the research and development of new treatments. So about C2AI, our key principle is that every person is unique and has their own clinical profile that changes over time. And from that, we can work out risks for that patient. So no patient is average, and every person has their own sort of, mix of things going on for them. We support clinicians through augmented intelligence and decision support tools, so not autonomous AI. And our algorithms provide deeper insights about patients, and they're based on the codes that are used by hospitals to record all the diseases or medical conditions that a patient has. And we do that in order to provide better care through either information on how health systems are performing or helping clinicians and patients make better decisions about healthcare at that individual patient level. The algorithms have been founded on 30 years of research and then 14 years of development, and they've been developed around 400 million patient records from 46 countries and in a very strictly regulated environment. Because patients are unique, as I've said, but also their clinical conditions change over time, we have a dynamic system that keeps re-looking at the risks for those individuals. And we do that by looking at over 3,000 metrics and a huge number possible permutations per patient to really say what is the risk for that individual patient. But what does this mean in practice? So the 4 examples I want to look at are, as I say, at the hospital level, for clinicians, for patients, and then for researching new medicines. So thinking about hospitals or groups of hospitals, and starting with that systems view, we know that hospital leadership and managers will be thinking, you know, is the care that we provide in this hospital safe? Where are we doing well? How can we provide even better care? And we can use the C2AI can use its algorithms to look at what's happened to patients, known as patient outcomes, across a department in a hospital, like the surgical department, or a mix of departments, or even across a range of hospitals. It's historically been difficult to see how well a hospital is performing because, as I said, each patient has their own individual clinical profile, and each hospital will be treating a different mix of individual patients. So that means a hospital that treats patients with more severe conditions, perhaps a super specialist hospital, may see more patients who have a worse outcome, for example, complications or even, sadly, numbers of patients dying, because those patients were more unwell to start with, where another hospital that doesn't see such unwell patients could have better outcomes. And how do you actually look at that and decide whether the hospital is doing what would be expected? And that's where the C2AI algorithms come in, because the algorithms look at those individual patient risks and can build up a picture across a department or across a hospital of where it's doing better than would be expected and where it's doing worse. And then importantly, that information can be used by the hospital to help the hospital get better. So it might be on focusing on a specific bit of care, such as how do we stop so many people having chest infections after surgery? Or it could be about saying, actually, we're doing this really well. Let's tell other parts of the hospital what we're doing. So it helps support behaviour change by informing decision makers like managers and medical directors to use the evidence to then help them plan their staff, so nurses, physios, medical staff, etc., training of staff. And then when a change has been made, C2AI can actually monitor the situation to see if there's been an effect. So that's at a system level. Then thinking of, for an individual clinician, the example I want to share here is the work that we're doing with the current waiting list for operations. You'll be aware, particularly those of you in the UK, the pressure of COVID has resulted in a backlog of people waiting for elective operations. So we know it's a priority for the NHS, and the waiting list or the surgery backlog, it's sort of different terms are used, is obviously a concern. And over the last 3 years, as a response to the pandemic, we've worked with a number of NHS trusts and other partners to actually help risk stratify and prioritise those waiting lists, those patient treatment lists, by giving a detailed view of clinical risk for each patient. So the algorithms work through the lists and produce a risk factor and the expected outcome for each patient on the waiting list, which clinicians can use for their decision making. We know if patients are waiting for very long periods of time, there's evidence that their health actually can worsen. And so that means by the time they're operated on, they're actually much sicker than they were previously. So actually being able to look at that is important. And the system's now being used in about 30% of regions in the UK. We've seen that the system can save time by removing the tasks of manually going through the records. So that's freeing up consultant time that they can actually then spend to see patients and clear those backlogs. But the impact is more than a reduction in the time spent on the process. It's actually about better understanding the clinical risk for that patient, which means identifying patients who are at higher risk and also working out how to use NHS resources better. Clinicians are seeing lower patient harm and lower number of deaths. freeing up of the time that patients are spending in hospital, less emergency admissions, and even less requirement for intensive care. So AI has helped behaviour change by giving information to clinicians to help them make decisions based on the individual patient profile and really identify those patients at highest risk. The third example is actually then thinking about patients directly and making decisions for that individual patient care. And this is part of our, what we're calling waiting well work. Some of you may have even seen this example. It was in the newspaper a couple of weeks ago. So as I explained before, we're using AI to help surgeons better understand the risks for individual patients and use that to work out their waiting lists and prioritise there. And we've taken that a step further, working with clinical leaders at NHS Cheshire and Merseyside and with another company called Surgery Hero on a project to identify at-risk patients and by identifying them, being able to then offer them prehabilitation before their surgery to keep them well while they're waiting and also improve the surgery outcomes. So that includes finding patients who are at risk of becoming more unwell while they wait. So perhaps people with chest disease or COPD or asthma, or perhaps people who are maybe even a little bit overweight. The programme has been heavily focused on patients at risk of getting a chest infection after surgery, and those that are identified then receive health coaching from Surgery Hero before they receive surgery. And that coaching, they work with a coach who explains why they've been selected and gives tailored advice for that patient to keep them as well as they can be and improve their outcomes and reduce the chance of complications. And the first 100 patients have now gone through the scheme and the results are very promising. So we're looking forward to keeping on working with that. And then in the last few seconds, the sort of new area that we're looking at now is actually how do we use those insights from the algorithms to help researchers and developers of new treatments to design them in a more inclusive way and to target their treatments to those who could benefit most. Coming from a pharmaceutical background, traditionally many new medicines have been tested with patients who are more often white, male, and generally healthy, apart from the condition the medicine's being designed for. But we know that that doesn't necessarily represent the patients who will end up using the medicine or treatment. And C2AI can provide insights into who those groups of patients might be to help better develop medicines for the future. As I say, it's a new area for us, but we're really excited about it to be able to bring in that real world perspective to improve development. So that's what I had to say today. So thank you very much.
Thank you, Sheuli. Really interesting. And when we at Claremont, we work on a number of medical research programs helping to try and recruit cohorts of people that are inclusive for the reasons you talk about, and making sure that the future treatments and medical interventions are genuinely reaching the whole population. So being able to see how that technology could help improve those programs is really fascinating for us. Thank you, and thank you for talking through the rest of your work. We'll come back to you again in the panel discussion. So yeah, Katie is primed and ready. So you know the drill at this point. Katie, yeah, share your screen and do talk to us about the work you're doing with OVO Energy and smart meters.
Hello all. How are you doing today? I've really been enjoying the presentations so far. I'm going to reshare my screen.
I was just going to say I can't quite see your screen yet.
No, it did load and then it said it was paused. So I'm just going to refresh all that for you now. Just by introducing myself as it's loading, as Ian mentioned earlier, I'm Dr. Katie Russell from OVO Energy. I've got a background as a mathematician, and now at OVO I've got a team of 60, 70 data scientists, analysts, product managers, data stewards, data platform engineers. And I'll tell you some stories, I suppose, about how we've tried to affect behaviour change using AI, both for our customers and within our own company. Can you see my slides now all right?
Yes, we can, and I can hear you fine, Katie. But someone has just popped a comment in the chat. It sounds like it was a user error. Don't worry. I was saying they couldn't hear you, but I could hear you fine. But yeah, so please carry on.
Fab. Okay, well then just briefly to introduce OVO, if you haven't heard of us, we were founded in 2009 and we're now one of the UK's largest green energy suppliers. We're motivated by our mission, tackling what's really the largest, what we believe is the largest challenge facing today's society, which is climate change. And along our journey, you can see some of the steps that we've taken to start to tackle climate change, installing our first smart meters, removing coal and nuclear from our fuel mix. A real world first, we installed the first bi-directional electric vehicle charger in the UK, and we've kind of extended our customer base by a lot, acquiring SSE in 2022, SSE Domestic Services. So that's a little bit about us, but as I mentioned, that I was going to talk to you more specifically about a couple of key examples. If it helps you, just think about your energy supply at home. So you will have an energy retailer that is responsible for measuring and understanding your energy consumption and then billing you accurately for it. So that's the space in which OVO operates, but with a mission to decarbonise customers' homes, focusing on electrifying their heat and their transport. So that's why we move into things like the electric vehicle charger space. Great. But it all started with smart meters. Energy suppliers in the UK were mandated to install smart meters, and customers needed to opt into that. And it's on the left, you can see some of the media coverage globally, where countries started to install smart meters. And it's worth saying that in countries where it was the players in the energy market that were responsible for the infrastructure who were installing the smart meters, the rollout went much more smoothly. And it wasn't necessarily opt-in. Whereas here in the UK, by design, customers need to opt in before they take a smart meter. And then on the right, you can see a little bit about where we are today. So if you have a smart meter, some of the insights that OVO's app gives you into your energy usage to help you save energy. And I'll tell you the kind of story of how we got there, which in a nutshell is that AI for Good helped improve smart meter uptake, and in turn, that's helped customers save energy and reduce their carbon footprint. So one of the first learnings was that when we were reaching out to customers to offer them the smart meters, we quickly found that they responded much more to what we would do with the data using AI for them than the fact that the smart meter could make their lives more convenient or their bills more accurate. So the messaging on the left was, you don't need to send meter readings, you'll get accurate, up-to-date bills. And there's some verbatim feedback from a customer giving an illustration, really feeling that they would get no benefit from a smart meter. Any discrepancies would come out in the wash, and they were pretty happy with the status quo. And then on the right, there's an example of the messaging that would be sent to our customers about what they, a different type of messaging, showing them what the smart meter would do for them. And then a happy customer who took the smart meter and found that they got, that they felt that the improvement was a massive one for the app. They really enjoyed being able to see where their energy spend had gone. And that was all powered by our disaggregation algorithms. I'll talk a little bit more about that in a minute. One thing I would note is that we really focused on customer feedback around this time, both in measuring like the conversion of which kind of customers and who and why people would take smart meters, because we were looking to constantly iterate and improve, but also once the app was launched. And so in a previous talk, Samuel mentioned about keeping your process even when you have AI as part of your tooling, and that was very much true here. So a really strong part of Ovo's process is to continuously measure customer feedback. And so, yeah, then just a little tiny bit more about how the energy tracker works once a customer does have a smart meter. What a smart meter means is, rather than like manually reading your meter and then sending off a reading every so often to an energy supplier and getting an updated bill instead of being billed on estimates, it means that we get your energy consumption broken down into every half hour of the day. So that's your electricity and your gas. And so combined with things like weather data, hello for the viewers from the Met Office, nice to see you here. So combined with things like weather data, we're then able to really help inform customers about where their energy spend had really gone in terms of heating their home, their hot water, their refrigeration, their standby usage. And there's a suite of different AI-powered algorithms or machine learning products, which then build up the different features in the application which help the customer understand their energy usage. Things like score to help them understand their use compared to others. Things like specific electric vehicle detection, which isn't just used for the app itself for electric vehicle owners, but we've also used it to help influence customers, well, to help them understand that we, for example, we released a new tariff that was miles cheaper than anything else on the market for electric vehicle owners. And so we wanted to make sure that the right customers knew about it. Cool, so that's a little bit, I think, about Energy Tracker. I mentioned, like, part of our process is just the importance of doing a lot of measurement of customer feedback, but also did, like, the smart meter mandate was because we collectively need to reduce our carbon impact. And so smart meters were positioned as something that if people could see their energy usage, then it could go down. And so it was really important to us that we actually measured that. And I'm pleased to say it has. In the first 3 months of users using this kind of energy tracker application, we see an approximately, the latest stat is 4.3% gas reduction, which for high users annually represents £68 and a carbon equivalent of 92.4 kilograms. And so across our base of, we've got 4.5 million customers in the UK, that's really impactful. So that's a bit of a story about behaviour change, because we needed to turn around the perception of smart meters, work out what would engage customers using data to help them opt in for a smart meter. And then once they've got the application, it's behaviour change around helping them reduce their energy usage and make the changes in their home. And it's all powered by AI, or at least data driven, when it comes to understanding the reasons for opting in. Slightly different tack of story, where I felt there were some parallels from the C2 tale, actually. And it perhaps brings us a little bit more up to date with the most recent energy crisis. When I asked you to think about the bill in your home, perhaps you would be thinking about these kind of headlines that have been in the news over the last winter. And the, yeah, I won't talk through them. You can see them there. My reflection is it's been a busy time, and we found that call volumes were mounting up, and we really wanted to do the right thing for our most vulnerable customers, our customers in fuel poverty, or that were vulnerable and really relied on their energy supply for reasons of health. And so we set about using data to do the right thing for our customers. A few different elements to that. One was using data to identify the customers who would be experiencing financial difficulty for the first time, really focusing on our own agents' behaviours. We set up really intensive training modules for our agents, created an empathy hub with lots of support from third-party specialists as well. The stat there of over 27,000 is the number of content views of our training. And what that meant was that customers that were experiencing financial difficulty for the first time got a kind of dedicated experience to really help them. And then further, I'll talk to you a little bit more about what we did for customers who were the most vulnerable. Similar, actually, again, to the C2 example of prioritization for those waiting for their operations. We identified that we didn't want our most vulnerable customers to be as impacted by the long call wait times that we had. And so we used machine learning to, I suppose, improve our data about our most vulnerable customers. There's an industry-wide standard where customers can self-select onto what's called a priority services register, but there are different reasons for doing that. It really quite varied. It can be age, it could be health reasons, and it can be financial vulnerability. So, and it can also be very patchy. I think someone asked a question about kind of patchy data and how do they improve that data before they can actually use it for some of the applications that C2 were talking about. And we had that challenge too. So it was a project in its own right to improve the data, understand the drivers for why people would have self-selected onto the priority services register, so that we could then do the right thing. And the upshot was that when customers were phoning in to the call centre, we were able to ensure that if a vulnerable customer had waited more than 5 minutes, we then put them onto a priority queue, and that reduced the wait time significantly for our most vulnerable customers, which felt like the right thing to do at the time. And then up next, well, I suppose it closes the story. I talked about energy tracker and how with a smart meter, we can offer customers insight into their energy consumption using what's called disaggregation algorithms. It's called disaggregation because it just breaks down the load into little pieces. It comes to us as an aggregated load of all of your usage, and then we disaggregate it by breaking it down. But those same algorithms that help the customer understand how they can save energy, we've also been using to help understand customers who are now using too little. So self-rationing because of the energy crisis, because of the cost of energy, starting to underheat their homes, which itself has health and risk implications. And so we've been able to use those same algorithms and models that we use to help tackle climate change and reduce carbon impact. We've been able to use them to start to identify customers so that we can, who are self-rationing, so that we can improve our products and services. So again, it's I think a story of behaviour change. With the payment support line and helping agents with their empathy training, it was really effective. What we particularly wanted to do for customers who were experiencing financial difficulty for the first time was persuade them not to cancel their direct debits. That was the trend that we were seeing in the data, was a lot of customers were cancelling their direct debits because they wanted to alleviate the cost burden on them during the energy crisis and also the wider cost of living crisis. But customers cancelling direct debits is also actually quite bad for them, because if you're not on a direct debit, it's more expensive for you. And so we needed to be able to find the right solution for those customers to get the benefit of a cheaper direct debit tariff, but whilst also getting the right setup for them. And we found that with the payment support line, we had 127% more direct debits preserved or set up than on our control group. I mentioned here that was kind of the customers that were most vulnerable could self-assess and take part in our customer support package, and there's some of the stats and the metrics that we measured around how we were helping customers at that time. And then I mentioned we're always very focused on customer feedback, and so this was some of the customer feedback from customers who phoned the payment support line or used the customer support tool, just to share with you there. Hopefully that's helped bring to life some real examples. I haven't talked too much about the actual AI or the data behind it, but I've shared with you, I think, a little about the process that we go through, often starting small, aligning around our values of doing the right thing and helping tackle climate change, and measuring an awful lot along the way with things like control groups, a lot of customer experience feedback, and ultimately at the end looking at the overall impact and were we achieving what we intended to. I'll stop now because I think it's time to move on to the panel.
Thank you, Katie. Really, really fascinating stuff, and actually, I'm really pleased you focused on the the human impact and not so much on the kind of the tech behind it, because it's behavior change we're here primarily to talk about today, and that was a very tangible example. Thank you. Okay, at this point I'm going to turn to our question master for today, Jude, who's going to chair the panel discussion. Have we been getting some interesting questions in, Jude?
We have indeed. So I have about 20 minutes. I won't get through to all of the questions. So I'm going to start with you, if that's okay, Sheuli. We haven't touched on the ethical side too much, but Anne White asks a really interesting question. How can you ensure that bias and assumptions are removed from the data?
Yeah, excellent question. So whenever you take a sample of data, so if you've got 100 people and you say, I'm only going to look at 20 of them, you've got your inherent risk of bias there. What we do is, if we work, for example, with a hospital, with their surgical department, we will take the data from all the patients. So there's no selection, random or otherwise. We just take all that data and process that all through. The data we use is actually, because I think there was another question about disaggregated, inaccurate and incomplete data. The data we use is actually the coding data, which is collected routinely for all patients who go into hospital, that codes for their conditions and what's sort of their journey in hospital. So that is done routinely for all patients, and it's not done by frontline medical staff. It's done by coding teams within the hospital who, that's their specialists. So that also helps to make sure that we've got the data we need for our algorithms, but also that it's all the data and nobody's selecting, oh, I'll analyze this patient but not that patient. So that's something. And I think one thing we are very mindful of is that medical practice does change over time. So we don't just have a static set of algorithms. We also look at them and make sure that they reflect current practice, to make sure that we're not biased by sort of having out of date things. So, for example, if there's a new type of treatment, a new way of caring for people with a particular condition, we need to make sure that our algorithms are reflecting that appropriately. Thank you.
Thank you so much, Sheuli. Very specific example for you, Anne White. I'd also like to put that question more broadly to you, Stuart, if you wouldn't mind. So, how can you ensure that bias and assumptions are removed from the data?
Without having a practitioner background, this is going to be a very academic answer. I generally lean towards a position that there will always be a degree of bias in the data, because there will always be steps of decision making. So for instance, yes, you can use all the data that is available to you, but someone has still had to make a decision about what data point to collect. And that could potentially introduce bias. Even the sort of algorithmic model you make, the decisions about weights and biases within the model itself, that could introduce bias. And as I said earlier, bias can be introduced retrospectively. You could have an output that is perfectly unbiased, whatever that means, but it could then be utilized and interpreted in a biased way. So for me, this is somewhat of a controversial position. For me, it's less a question of eliminating bias and more a question of accepting bias and then thinking about how we incorporate the flaws of any process into whatever process we ultimately use.
Oh, thank you so much for that answer, Stuart. Hopefully that answers your question, Anne. So I'm going to move now to Samuel, and we've been asked by Sarah, or it could be Sarah, about any interesting resources focusing on using AI. And I'm also keen to know the answer to this question. So we're all struggling to keep up, Samuel. What books, podcasts, websites, newsletter, what is it that how do we keep up to date? How are you keeping up to date?
Well, talking about bias, I'm certainly biased on this question, given that I'm part of founding Habit Weekly. And so Yeah, so Habit Weekly was founded as a way to make sense of what it means to do behavioral science in practice. And we recently, or actually very soon, we were launching kind of an AI and behavioral science focused publication with resources and regular updates and opportunities to discuss specific questions to it. So habitweekly.com, and then soon to be more on that front.
Can I chip one in on that, Jude, as well? And actually, I first saw this because Samuel, I think, shared something from this blog on LinkedIn. But there's a blogger called Ethan Mollick who blogs on. I think he initially set the blog up. It's called One Useful Thing, which was meant to be about a range of different things over time, and he's ended up focusing entirely on AI over the last few months. And his blogs are incredibly informative and terrifying. So yeah, I definitely recommend that.
Yeah, and he comes from an educational perspective, which is quite interesting. So I agree, he's really great.
Some great tips there. Thank you so much, Samuel. I'm already signed up, and thank you for your contribution in. I'm sure everybody's scribbling down those resources. So next, I have a question for Katie. If someone here today wanted to commission or develop a similar approach to the one that you've presented, what are the most important things they'd need to consider? So I know that you finished talking about values, keeping small and measuring. Can you expand on that a little, please?
Yeah, sure thing. Thanks, Jude. Yeah, so Samuel mentioned it, using your process. And so what I mean by start small, think big, and then scale fast. When you start small, what you do is you identify perhaps even the simplest possible thing that you can do that adds value towards achieving your intended outcome. The use case that unlocks and also helps you measure and learn your progress towards the thing you want to achieve. It's really important to be use case led rather than think about the kind of solution and trying to build the end solution. If you think about what you want to build it simply. It lets you explore the full, I suppose, the full functional life cycle when it comes to an AI tool of get the right data, integrate it, get the right or perhaps even the most simplest and explainable model, integrate that, and then put it into an end outcome that you can measure. That's already a lot. Like, it took me quite a long time just to talk through that as a process. And so if you try and start really small with what you're doing with that, which means that perhaps the data you're using is rather small, the outcome is rather contained, it means that you can learn as much as possible about the kind of full end-to-end, because you don't know how it's going to play out. But then thinking big is probably that you've got the big vision of the end picture of what you want to achieve with it. And so you can at least design things that are extensible. And scaling fast is really supported by measuring an awful lot along the way, so that you're really understanding your customer feedback, for example, at each point of the journey, if you're designing a customer facing tool. And frankly, all of that is just good product management practice. And that's probably another part of if you were going to go about this. I would always advocate for assembling a team of people that's cross-disciplinary. So at OVO, that looks like product managers, software engineers, data scientists, user researchers, and bring all of them together. From a data perspective, just one thing I would say is always understanding your sources and the technology, so that you can really explain and be transparent with the outcome along the way.
Excellent answer.
Can I just add a little bit to that?
Absolutely.
Yeah, so I think I'm just echoing Katie's point about sort of understanding what you're trying to do. One of the things that we spend a lot of time doing is talking to the clinicians that we work with to really understand the clinical context, because you know, and I think from the things in the chat and the questions about, you know, bias and et cetera, is really saying what can we do that is helpful and will make sense in the context, and to Katie's point about the data, and what makes sense with the data that we've got, and what are the limitations of that. So that's really important, because, you know, we can have sort of great ideas of, oh, we could do this, this and this, but actually if if all the other things don't add up, there's no point in us doing it. So
thank you so much for that, Sheuli. So I do have another question. I know that it's been answered already by Samuel, but I'm first going to put it to Stuart, because I know that in your book you talk about some of the work that Susan Mickey's involved in at UCL, some really complex things that they're looking at literature reviews, especially in relation to smoking. So I think this relates to that in some way. How can we trust AI to summarize documents accurately? Stuart first.
That is a very big question. So what I bring up to my students, and at this point their eyes glaze over, there's a section in the UK government's 2020 report on algorithmic use in government. I don't know if Susan Mickey had any influence on it, but in the section they talk about the process flow of how algorithms come to exist, and then what information is fed into them, and then how the outputs come to be used. And at each step of the process, at least from the UK government perspective, they insist that there be a person either making the decision or in consultation with the outcome. Now, obviously, many of us have behavioural backgrounds here. People can make mistakes. They do not necessarily make the best judgments, but it seems to be, at least from a government perspective, that the way to build trust into the system is to have people, have actual humans involved in the processes, people who are accountable, but who can also relay what is going on in the process. Right now, that seems sensible to me, and it seems to be the sort of approach which other industries are adopting. So for instance, ChatGPT came out in November, I think, and it can write code. Well, the grandees of GitHub, the coding website, came out quite quickly and said, when we as humans review this code, it's flawed, and therefore we're not going to permit ChatGPT code to be put on the site. That to me seemed that there was an external placing of a person in the loop to try and retain trust that SOs like GitHub have. So that to me is my initial feeling of how you maintain trust. As I said in my talk, my major concern is that people come to trust these AIs too much.
Okay, thank you so much, Stuart. Samuel, do you have anything to add to that from your perspective?
Yeah, so in terms of adding some kind of context to it, I would say the question was whether AI is good at summarizing. And obviously it depends on the model. And so the first question is, which model are you using? If the person is using the latest OpenAI model, the GPT-4, I would say it's pretty surprisingly reliable. Like we've used it quite a lot in work and for some time now to test. And it's by itself very reliable. And then if you feel still unsure if it's more of like a large intervention, it's more than just you typing in something from your meeting and you want to increase reliability, there are ways to do that to quite a high degree where you can either obviously improve the prompt to make that extremely reliable and predictive, but also you can do things that are something like fine-tuning, where basically you provide the model of, let's say, 100 good examples or 500 good examples. And then you say that when you generate the 501 example, they should be all similar to this. And if you have then a really good model like GPT-4 combined with a very good prompt, it's incredibly reliable. It's really, really impressive and can scale quite quickly. So yeah, I think it's wild what happened, because that wasn't the case 6 months ago. I remember a lot of the summarization that was done by GPT-3, for example, it wasn't as reliable, but now it's been very much a big change.
Thank you so much, Samuel. Two quite different answers there, and I think that adds to the richness of this event. It's coming to close to 11 o'clock, so I have one more question and I'm going to put that to the panel in turn. So today's event is called Can AI Help Change Behaviour for Social Good? And I think that we've established that, but will the benefits outweigh the dangers? Stuart, I'm going to put that to you first.
If we're talking about strictly AI, I think they will. I think there's a bigger question that AI is a tool which people and organisations have to use, and I think there's an organisational question about how best to use AI, separate from the question of AI, which needs to be tackled in order to maximise the benefits. If we're strictly talking about AI, I think it is an extremely useful tool in our current data-intensive world.
Thank you, Stuart. Same question to Samuel. Will the benefits outweigh the dangers?
Yeah, I think I second Stuart's answer. I would really underline the importance of putting pressure on the likes of Google and Microsoft, who are currently the very big players, and they are kind of in this fight to show us the kind of the coolest toy in some ways, and that creates a lot of risk because they're publishing these models at an increasingly high rate without maybe doing as much safeguarding it and testing it and ensuring that it doesn't result into kind of bad use cases. So I think that's the most important thing, that we really start putting a lot of pressure on the core models to make sure that they're ethically kind of put out there and used. And those companies especially have a lot of role to play there. So yeah, I would say we should think about it as kind of like an atomic weapon type of thing, where it's a really, really influential tool, and we should really, really then have very safeguarded underlying mechanisms for how it's developed and shared and kind of distributed.
Thank you so much, Samuel. I'm going to ask that same question of you, Sheuli, if you can answer. Will the benefits outweigh the dangers of AI?
Yeah, thank you. And I'm going to follow straight on from Samuel's comment about having the safeguards along the way. So from my space, from sort of health and medicine space, you know, there's real, well, we're already seeing really good stuff and there's real potential, but picking up on some of the comments in the chat, we need to make sure we're doing it in the right way. So patients are individual people, and, you know, what we do, not just with their data, but in terms of the AI and the apps and potential for there needs to be really thought through, so that we're using them in a helpful way, in taking account of biases, etc. Not over promising, but really sort of having that clinical and patient decision making at the end of the day. So so yes, but in the right way.
Thank you so much, Sheuli, and I'm going to ask that question now to you, Katie.
Thank you. My view is that I really hope that very soon there'll be a shift back towards data protection and privacy of individual data, and curtail the oversharing. And so for me, that is a true social good, because the risks of AI will hopefully help people understand why not to overshare, why to protect their data. And in turn, perhaps there'll be almost like a backlash, yeah, around data protection, better data privacy of your own personal data. And in turn, that could turn into a real, almost like paradigm shift, so that those who truly understand how to create AI powered products with real diversity, with applied behavioral science, you know, could experience a real golden era.
Thank you so much for that answer, Katie. I could talk to the four of you all day about AI, but unfortunately we're coming to the end of this webinar, so I'm going to hand back to Ian Fannin.
Thanks, Jude. Thank you. And thanks to all the panel. That was absolutely fascinating. I'm still on the fence, I think, about whether it's a good thing or a bad thing. I think I keep reading Ethan Mollick's blogs, and I worry. And I would recommend, as I mentioned earlier, listen to the Moral Maze on Radio 4. They asked that question at the end of their long discussion, and the panelists were split 50-50 really on whether this was an existential threat to humanity or not. So I think for me, the jury is out on that. But in the meantime, I can certainly see there's plenty of ways that it can be used for social good. So we're going to wrap up now, but and thank you to everyone for their contributions today, and to Jude for chairing the last session. If you've enjoyed today's event, please do sign up to Claremont on the Claremont website and follow us on Twitter and LinkedIn. You'll always hear first about future events we're running on those channels. I believe that the information there is in the chat for people to do that. If you've got any comments or feedback on today's event, also please do email us at hello@claremont.org.uk. But otherwise, that's it for now. So hope to see you again soon, and goodbye.